it was already mentioned, it was a pretty much last-minute weekend deal for me. But here we go. The top one. No disclosures. So, who's the advocate? Who or what is the advocate? So the Google definition is publicly recommend or support, and the dictionary recommendation or the answer is to plead in favor of. So when we talk about advocacy for you, it can take two meanings: you as a person, personally, or you as a surgeon physician. So I'll deal with the you as a person first, which is self-advocacy. So self-advocacy refers to an individual's ability to effectively communicate, convey, negotiate, or assert his or her own interests, desires, needs, and rights. So essentially, it comes down to basically speaking for yourself. That's plain speak. And everyone knows if you're not at the table, you're pretty much going to be on the menu. So how are you going to prepare to advocate for yourself? Know what your priorities are. The priorities of your spouses are going to be equally important, if not more important, than your own priorities a lot of times. Your practice type, geography, location, what are you looking for in terms of patient population? What kind of practice are you looking for? Whether it's a teaching facility, if research is important to you, you need to make sure that you're asking the right questions and making the right choices. Lifestyle, as has been alluded to by all my previous speakers, that's extraordinarily important. And then once you make that, have those answers for yourself, you need to figure out what is your worth. Sure, compensation is a very important number, but there are many other factors that are going to be even more important in how you make the choice. A lot of times if you get things that you like, that are essential for you, maybe it's office space, protected time, other benefits, that compensation number can be a little bit lower, provided you get all these other things to make up for it. And in terms of negotiation, you need to be able to leverage your expertise and your experiences and negotiate for what you want in terms of research support, administrative support, in terms of getting protected research time, mid-level support, nurse practitioners, PAs, patient care coordinators, flexible scheduling. All these are things that will make your life a lot more easier. So once you establish your value to the organization, they should be able to recognize what sort of unique experiences and contributions you bring to the table. And you should be able to articulate your value proposition to the organization and how that's going to enhance patient care. If you perceive that there is an issue with pay parity discrepancies, make sure that you understand or talk about gender bias. Sometimes there is lack of transparency in compensation structures. Other times, you are just at the bottom of the totem pole as the new hire. So if you feel that there are unfair practices, you should be able to advocate for yourself. The strategy that you pick is going to depend on what sort of practice you're picking. In the same city, in the same geographical location, your compensation, what you get, is going to be very different depending on academic medicine versus private practice versus being employed by a large hospital system, or if you're an independent contractor. So know whom you're going to be speaking to. And help is extraordinarily essential. Communicate with all your mentors, people who have your well-being at heart. It may be someone from residency, fellowship, other professional organizations like ACS, SAGES. Anytime you look at a contract, you're thinking about signing a contract, always have a contract lawyer in hand. The few $100s that you're going to be spending on that is well worth its weight in gold. Pay attention to the metrics of how you're going to be assessed, how productive you are. who's going to provide cross coverage, the time that you take out to come to SAGES, when you go on vacation, expenses, malpractice, again, it's been talked about earlier, tail coverage, stuff like that. Protected time, how much protected time, and for what? Contract clauses, termination clauses. Pay attention to all those things which are going to be very important. It is very easy when you are the newbie in the practice to not know the lay of the land, so as to speak. And sometimes there is a hidden agenda, a hidden curriculum. Learn to read in between the lines, learn to read your room well, figure out why you are there in the first place. And sometimes it's your associate health staff who are going to have some of these answers for you, including nurses or your mid-level providers. They are a great resource and how things work. One of my mentors, when I was much younger, told me that these are the 3 A's for success. And he said it is availability, affability, and ability. Notice, ability came last. He said, if you're going to be available and affable, you're going to succeed. And success is going to be very important if you're going to be able to self-advocate for yourself. So it's tempting to be a yes man. It is okay to say no. Trust me, no is a very good word. And it's important if you're going to be able to take care of your own physical and mental health, take care of your family and your own finances. So let's move on to physician advocacy. And this is one of the definitions that I found, action by a physician to promote those social, economic, educational, and political changes that ameliorate the suffering and threats to human health and well-being that he or she identifies through his or her professional work and expertise. And I got this definition from academic medicine. So just pick anything that you're passionate about. That's very important, and it should align with your own value systems. And once you know what you want to advocate for, the important takeaway point is that this is not for your own personal gain or opinion or benefit, as opposed to self-advocacy. This is going to be for the patient's benefit. And what is action in physician advocacy? It all comes down to identifying an area of concern, you gather evidence-based information, and then you commit to action. It is extremely important to be able to collaborate with others, to mobilize the resources that you need, and finally, to be able to sustain the effort. So this is a statistic that I picked up, that physicians vote less often than lawyers and the general public. We as a group, unfortunately, aren't into advocacy very much, and physician contributions and lobbying more likely relate to financial incentives for the most part, rather than healthcare initiatives. So you can go across the entire spectrum of advocacy, starting from an interpersonal level all the way to policy, starting at the patient level all the way to global healthcare advocacy. And whenever you engage in physician advocacy, remember to respect the patient's autonomy and beliefs and allow patients to be fully involved with their healthcare decisions. Again, this is a statistic that 90% of residents believe that advocacy is a physician's duty, but only less than 20% said that they believe that they received adequate training during their residency. So let's look at a case study. A 29-year-old single mom of 5 children from Mexico, limited English proficiency, no transportation, has missed 3 prior appointments with their practice and is already late by half an hour. And the rules of your practice say that you shouldn't see the patient and just discharge the patient from your practice. And it may be tempting to do that. You have a busy schedule, you don't want holes in your office schedule, it means loss of work hour views, all that stuff. But you as a patient advocate, you can certainly involve a Spanish medical interpreter. If you don't have those services, talk to management about the need for those services. See the patient, more importantly, that particular day, and make sure that the patient is not dropped from the practice. and promote screening for transportation needs. These are some of the things that you can do as a physician advocate. What about local advocacy? So let's say you've seen several patients from the same apartment complex over the past couple of weeks with asthma exacerbations. And upon further questioning, you figure out that there's been a flood in the apartment and the carpet and the walls remain moist and damp, and the landlord doesn't plan any further renovations. So you should be able to familiarize yourself with the state's laws on mold mitigation, call up the landlord, try to talk to them about the healthcare problems that you're seeing, and if they don't plan on making any changes, escalate. Maybe to a local news station to get more coverage for the story and publicly speak on their behalf. What about state and federal advocacy? So let's say you work in ED and you've seen increasing number of combustion injuries and poisonings related to e-cigarette use. You can familiarize yourself with your state senators and representatives, write letters, make phone calls, talk to your legislators, join national coalitions like the ACS, or SAGES has its own AHP committee for that matter. Write an op-ed or a letter to the editor of your local newspaper. These are all some of the ways that you can participate. How about global advocacy? You can, let's say you go on a medical mission trip and you see that people there have to travel 3 hours just to get to healthcare. Learn about the existing healthcare infrastructure in the country. Garner support from local institutions in the United States. Build trust with local partners in the country. And fund a small clinic or a hospital to begin with. And yes, there are barriers to advocacy. There are time constraints, everyone's busy. There is even a perception of institutional disapproval. So all these can be barriers. And I've also seen other competing perspectives that advocacy is a counter to academic pursuits, and since it seeks to change rather than promote knowledge. There are always two sides to the same coin. But bottom line, I'll say that it should be and is endorsed as a physician competency, and you can and should be an active decision maker in advocating for your patients and incorporating that practice into your practice. Thank you.